Hello, my name is Sondra. I'm a physical therapist assistant and I work in a hospital. It's not uncommon for me to encounter on my patient caseload patients who have struggles with obesity, cardiac disease, stroke, diabetes, emphysema, and cancer. Just a week or so ago, I had some patients that had coronary artery bypass grafts, 8 men. I also had a 32-year-old female with 8 children who weighed over 300 pounds and had developed a chronic pulmonary disorder. Pretty much every patient that I see is affected by diabetes or prediabetes. I had a 70-year-old man with esophageal cancer and a tracheostomy. Would you be surprised to know that these are preventable illnesses and that the prevention is fairly easy? The National Coalition for the Promotion of Physical Activity reports that moderate intensity physical activity, such as brisk walking, as recommended by the Physical Activity Guidelines for Americans, is associated with a substantial risk in chronic disease. 30 minutes of brisk walking a day, 5 days a week, 150 minutes of walking per week. Simple, easy, and a way to significantly reduce your incidence of chronic illnesses. The Federal Obesity Prevention Act of 2008 provides grant demonstrations and pilot programs to address overweight and obesity issues. It also calls for the inclusion of promoting increased physical activity and healthier lifestyles. The Safe, Accountable, Flexible, Efficient Transportation Equity Act, a legacy for users, which is a mouthful, so we'll refer to it now as Safety LU, contains support for bicycle lanes, pedestrian walkways, and recreational trails. Section 2172 of Title 23 of the law provides provisions for improved lanes, paths, and shoulders for use by bicyclists, and a traffic control device, shelter, or parking facility for bicycles. Section 1109 provides for funds to maintain and restore existing recreational trails and to rehabilitate trailside and trailhead facilities and assess trail conditions for accessibility and maintenance. These two pieces of legislation pave the way for cities to adopt ciclovias in an effort to increase the physical activity of its inhabitants. What is a ciclovia? Well, ciclovia is a Spanish term for cycleway. Ciclovias are programs that began in Bogota, Colombia, and Guadalajara, Mexico in the 1970s. Ciclovias, or cycleways, originally promoted bicycling along these routes. Ciclovias are held weekly on Sundays in these cities and on public holidays from 7 a.m. to 2 p.m. The city streets are closed along a predetermined route to vehicle traffic and then is opened for free to participants to walk, ride, run, rollerblade, and bicycle. Along the route, there are stages set up for yoga and Zumba and other physical activities. Ciclovias are promoted by city government and supported by the Transportation Department. 30% of the population of Bogota, or 2 million people, attend ciclovias. These are gaining popularity in the United States, but are not called ciclovias. They are known as open streets programs. Cities such as Atlanta, Georgia have what they call Atlanta Streets Alive, and San Diego and San Francisco also have open streets programs regularly. Cities generate in-kind donations and sponsorships from stakeholders in order to have these programs. Increased physical activity decreases healthcare costs. The estimate is that $5.6 billion in heart disease costs could be saved if 10% of Americans began a regular walking program. Remember, 30 minutes a day, 5 days a week, 150 minutes a week. Within 5 years, the return of investment for every dollar spent on community-based programs promoting increased physical activity is $5.60. For every dollar invested in building bike and pedestrian trails, nearly $3 in medical savings may be achieved. Ciclovias need no additional funds to be raised as existing infrastructures are used. There are so many benefits to increasing physical activity through ciclovias. Ciclovias promote fellowship and unity among the participants. They help to decrease chronic illnesses because they're encouraging people to be more active. And then the healthcare costs can be decreased. And they provide a safe and fun and social way for members of a community to increase their physical activity. Wouldn't it be great if every city had ciclovias each week? Wouldn't it be great to increase our physical activity and decrease the incidence of chronic illnesses? Wouldn't it be great to meet new people, get healthier, and save on healthcare costs? Wouldn't it be great if I, as a physical therapist assistant, could help promote health and wellness instead of treating patients with chronic illnesses? I have a challenge for you. Look for and participate in your community's physical activity programs. And if you can't find one, start one.